السلام عليكم ورحمة الله وبركاته. محاضرتنا عن البوست كراون، والهدف من هذه المحاضرة هو التعريف بالبوست كراون. ما هو البوست كراون؟ ما هي البيزك components of the post crown؟ راح نعرف شو وقت نقدر نستخدم البوست كراون، ما هي الانديكيشن، ما هي الكونترا انديكيشن to use the post crown، ما هي requirements of the tooth to accept this restoration، characters of ideal post، الclassification والأنواع of the post crown، والfactor that we have to be considered when we want to apply this restoration. Finally راح نتعرف على tooth preparation to accept this restoration. ما هو البوست كراون؟ البوست كراون هو عبارة عن fixed restoration replace the coronal portion of the tooth and retained itself by a mean of post which extended and cemented inside the canal of endodontically treated teeth. ما هي البيزك component of post crown؟ البوست كراون متكون من البوست، الكور and the crown. ما هو البوست وما هي الوظيفة للبوست؟ البوست اللي هو عبارة عن relative rigid restorative material placed inside the root of endodontically treated teeth. The function of the post: firstly, retention of the core. Secondly, transmit the force which applied on the core to the root. Thirdly, prevent the horizontal or horizontal fracture or increase the resistance of the root against horizontal fracture. Now, what is the core? The core, it is the supragingival portion, replace the missing coronal tooth structure. ما هي الفانكشن of the core? Provide foundation and retention for the final restoration for the crown. الآن the third component of the post crown is the crown. الكراون هو عبارة عن final restoration that placed over the core. وممكن إنه يكون أي نوع من الكراون، كأن يكون full veneer, jacket, full metal, any type of crown. To apply this restoration لازم عندنا شرطين، ولا بد من تواجد شرطين معا. شرط يتعلق بالcoronal part of the tooth وشرط يتعلق بالروت radicular part. بما يتعلق بالcoronal part هو when we have insufficient coronal tooth structure can't provide the required retention for a coronal restoration. الشرط اللي يتعلق بالروت we have sufficient root length to accommodate and receive the post and perfect and adequate apical seal. هذني شرطين أساسيات، من عندهن راح نتحدث عن indication والcontra indication of post crown. The post crown could be indicated in case where there is insufficient tooth structure for endodontically treated teeth. Case of short crown could be indicated for treatment of malposed teeth or as a retainer for short span bridge. The contraindication for post crown restoration تتضمن tooth with sufficient coronal tooth structure, so there is no need for post-crown. Another contraindication when we have cases of failed endodontic treatment, or when we have cases with insufficient root length. الروت length اللي نقصده بهاي point, not the anatomical root length, but the root length which is supported by bone. Another contraindication when we have root with caries or resorption. الcontraindication بالحقيقة تنطينا reflection لل requirements of a tooth to receive a post-crown restoration. هاي requirement تتضمن optimal apical seal, absence of active periapical inflammation, fistula, exudate, there is no sensitivity to percussion, there is no mobility, absence of associated periodontal disease with good and sufficient bone support for the root. In addition to that, we have sound tooth structure coronally, coronal to the alveolar crest. There is no fracture, sufficient root length and width. المواصفات المفضلة عند اختيار واستخدام البوست كراون من ضمنها أولاً minimum preparation, easy to adjust and fit, less technique sensitive, be easily available and not expensive, provide maximum protection for the roots and which support the roots against the root fracture. It should be retentive, easily removed. As a material, it is preferable to be of material with high strength and fatigue resistance, has elastic modulus similar to that of the dentin. This is to give the best stress distribution. For checking with an X-ray, it is preferred to be a radio opaque material, biocompatible material, not corrosive material, be aesthetic, especially we want to use it in anterior segment. We have many types of post, which could be classified according to the method of fabrication or how they are made into custom-made and prefabricated post. الcustom-made or laboratory-made post هي بالحقيقة عبارة عن negative reproduction of the prepared canal. So it has advantage of close adaptation and fitness to the prepared canal. لذلك فهي indicated for the cases of ovoid, triangular canals, and contraindicated in cases of very narrow tiny canal or severely curved canal. According to the material, it could be classified into metallic and non-metallic type of post. الميتالlic could be gold alloys, platinum, palladium alloy, base metal alloys, cobalt chrome, molybdenum alloys, nickel chrome alloys. Non-metallic as ceramic post. Prefabricated posts, this type يتميز بالsimplicity of the technique. There is no need for impression taking. This type comes in different size and design, so we select the posts of design that closely match to the size of the prepared canal that fit which could be fit in the canal with minimum preparation. Again, it could be metallic or non-metallic. الميتاليك يا إما يكون gold plated stainless steel or titanium and titanium alloys or high platinum alloy or cobalt chrome molybdenum alloy. هذا الميتاليك. عندنا بالنون-metallic we have many types like the fiber reinforced resin based composite, post, quartz, zirconium, glass fiber, carbon fiber, composite, and post crown, which is made from plastic. This is of special importance in the preparation and the fabrication of the custom made. This is the plastic post. ممكن تقسيم أنواع البوست كراون حسب number of units. It could be 1 unit or 2 units. بال 1 unit حيكون ال final crown is direct extension of the post. It is indicated for tooth with very short clinical crown, as in case of lower incisor. In such case, where there is insufficient space for core and separated crown. So the restoration of choice in such a case is the 1 unit custom made post. بينما ال 2 unit post crown has several advantage. من بيناتها case of patients under 18 years old, because of the continuous change بالgingiva or gingival tooth relationship. After a time there is expected gum recession and crown lengthening, so we can replace the crown, keeping the post and core undisturbed. Another advantage for 2 units post crown is the possibility of a crown replacement when we have damaged crown or any defect for the crown. Just we replace the crown without any disturbance or interference with the post and core. Another disadvantage in case of a bridge abutment. So with the 2 units post crown, we can adjust the core to achieve the required parallelism for the insertion of the bridge. الفائدة الأخرى هي ال satisfactory marginal fit. نقدر نحصل satisfactory marginal ridge as the expansion rate of 2 parts, post and core part and the crown, separated the crown, can be individually controlled. بالنسبة للprefabricated دائما post prefabricated post دائما هو 2 units. دائما 2 units, post and core and the crown. After the insertion of the post inside the canal, the core is built around the coronal extension of the post using restorative material. Among these restorative material, الأملغم يتميز بالstrength. It has modulus of elasticity closer to the dentin, while the composite يتميز بال support لينطي التوث structure. الكلاسيفيكيشن الآخر للبوست يعتمد على relation of the post with the canal wall. So we have active and passive post. بالactive post there is a mechanical engagement with the canal wall وهو دائما threaded prefabricated type. They are retentive but cause stress generation during the post placement and under the functional load. بينما passive one it is cemented inside the canal with the aid of cement because there is no engagement with the root canal. So it is less retentive but produce less stress. الكلاسيفيكيشن of the post ممكن يكون اعتمادا على البوست ديزاين. ممكن إنه يكون smooth, threaded, serrated, tapered, parallel, or a combination of two of these design. دائما ال prefabricated ممكن إنه يكون بأحد هذه الديزاينز المذكورة، لكن ال custom made دائما يكون smooth with some of tapering. These are examples for different types of post of different material and different design. This is the metallic one, and this is the tooth colored, and this again the tooth colored post, and this is the carbon fiber post. Regarding the design, we have two main groups: the tapered one and the parallel one. This is example for tapered smooth, then tapered serrated, and tapered thread. This is the parallel smooth, parallel serrated, and parallel threaded or thread. Now, what is the factors that we have to be considered with the post application? We have many factors, among them the post length, post width, and post design are the most important. We have another factor like the looting agent, but we will concentrate on these three factors. ممكن فهم ال effects of the post length من خلال الإجابة على الأسئلة التالية. أولاً, post should have maximum length. Why? This is because the longer the post gives greater retention. In addition to that, the increasing of the post length leads to increasing of the fracture resistance. This is the case of post with short length, which is ended with a fracture of the root. ثانيا, how much getaperca is required apically? It's preferably to be 5 millimeter of good seal without any disturbance or displacement during the canal preparation to receive the post-crown. ثالثا, what is the relation of post length to the bone support and the crest of the alveolar bone? The post should be at least about one half the length of the root, which is supported with bone, and about 4 millimeter apical to the crest of the alveolar bone. Now, what is the relation to the crown length? The post should be at least equal to the length of the crown. خامسا, what is the effect of post material on post length? We have metallic posts which require non-adhesive cementation, and we have another type of post, fiber reinforced, for example, which requires adhesive cementation. So, in case of the metallic post, it should be as long as 2/3 of the canal length, while the fiber post, which is required adhesive cementation, it could be equal to 1/3 or 1/2 of the canal length. It required less length, shorter. It is shorter than the metallic post. سادسا, regarding the molar post should be not extended more than 7 mm apical to the canal orifice. Why? This is to avoid the risk of canal perforation. This is summary for the required post length. Apical gutta-percha preferably to be 5 mm with perfect apical seal, and disturbed gutta-percha. The post length preferably to be equal to the crown length, and we have to get good ferrule effect by keeping supragingival tooth structure of 2 mm in height and with minimally 1 mm thickness. البوست diameter دائما يعتمد على thickness of the root canal wall and the root canal space. It should be not exceed 1/3 of the root width at its narrowest dimension. This is in order to resist root fracture. Too narrow post is vulnerable to fracture, while the too wide post result in weakening of the root. Another factor which have to be considered during the application of the post is the post design. Post crown can be serrated, smooth, threaded, or parallel-sided or tapered. من بيناتهم parallel-sided are more retentive than the tapered one, بينما the threaded posts are more retentive than the cemented one, but cause more stress. In conclusion, parallel serrated posts are cemented into the canal passively, so there is no stress, but as it is parallel side, they are retentive, producing less stress in the root dentin than the threaded system. الآن راح نتحدث عن التوث preparation اللي هو يتضمن the crown preparation and the canal preparation. The crown preparation started with the removal of all the unsupported enamel, weak tooth structure, which is vulnerable to future fracture. We have to remove all of the old fillings or cement-based material. At the same time, we have to leave about 2 to 3 millimeter sound tooth structure supragingivally to get good ferrule effect. The coronal portion then completed with the suitable finishing line according to the final crown, whether it is jacket or full metal. So accordingly we will decide the type of the finishing line. One of the important steps in the crown preparation is the reverse or contra bevel. What is the contra bevel? contra bevel هي عبارة عن reverse bevel placed around the occlusal external surface of the periphery of the preparation. شنو فائدته؟ الفائدة من عنده هو to provide a collar around the occlusal periphery of the preparation, which will be helped to hold and support the tooth structure together, prevent future fracture. The canal preparation started with a radiographical checking for the length, width, and the shape of the root, and the quality and type of the filling, especially the apical third of the root canal. Then, after checking with the aid of hot intracanal instrument like hot spreader or a piezo reamer or gesigliden, we can remove the guttapercha up to 2/3 of the root length, leaving 5 millimeter of the apical guttapercha. We have to be careful during the removal of the guttapercha to avoid the displacement of the guttapercha of the apical part. The canal should be parallel sided with a slight coronal flaring. With the aid of flat and carbide fissure wire about 1 to 2 millimeter in diameter and 5 millimeter in length, we can prepare a keyway with the same dimension as the area of greatest bulk. What is the advantage of this keyway? Firstly, it acts as a guide during the placement of the post-restoration. It could improve the retention. It acts as anti-rotational device by preventing the post from rotation. In addition to the keyway, we have another anti-rotational device like the triangular shape of the canal orifice in the incisor and the elliptical shape canal orifice in the canine. Besides that, the pinholes again could be acts as anti-rotational device. It's important to mention that in the posterior teeth, the molar and premolar, a single post should be placed in the largest canal as the distal root of the mandibular molar and palatal root of maxillary molars, and the longest striated root of maxillary premolar. Custom-made post-crown can be made with one of two techniques, the direct and indirect technique. In the direct technique, we made an impression for the canal with the aid of plastic post and wax or resin. This wax or resin pattern will be undergone an investing and casting procedure to end with the metallic post and core. The indirect technique achieved with the aid of an impression material, again plastic post and impression material, silicone impression material. This is an illustration for the direct technique. After the crown preparation, we will remove the guttapercha from the 2/3 of the root canal. Then we select proper size of plastic post. We check it inside the canal. Then we will make a serration on the external surface of the plastic post. This is to ensure the attachment of the wax or resin on it. Then we will, after painting of the post with the wax or resin, we will make an impression for the canal. After that, we will reinsert it inside the canal, and we will build the core to get a final form looks like a prepared crown. Then the wax pattern will be converted to a metallic post and core after the investing and casting procedure. Then the metallic post and core will be cemented inside the canal, and we will make an impression to make the final crown. In the technique of restoration using post-crown with prefabricated post, the guttapercha will be removed with the aid of hot endodontic spreader or Getzig or piso reamer. After the preparation of the canal, we will insert the post, and the core will be built around the coronal extension of the post. Then we will prepare it into a form similar to a prepared crown. Then an impression will be taken to make the final crown. The homework 2 to answer this question: what are the factors that could increase post retention? Finally, thanks a lot for your kind attention with best wishes.